Hi everyone. Welcome to this talk on the project Layering Trust in Intimate Digital Health Technologies, Learning from Challenging Experiences. I'm Aira Lampinen, I'm an associate professor at Stockholm University, and I run this project together with Madeleine Beilam from KTH. And together with us we have a fairly large team of researchers from across KTH and SU. To get you situated into what we're studying, we are focusing on digital contraception, and we are studying in particular the Natural Cycles system. Natural Cycles is a Stockholm-based company that provides a digital contraceptive option to more than 700,000 users worldwide. We consider it a digital contraceptive since the system uses daily readings of a user's temperature, an algorithm and machine learning to develop a model of the user's reproductive cycle. This allows the smartphone application to detect ovulation and thus predict periods of fertility. It can then recommend the user to the use of a barrier method of contraception to avoid an unwanted pregnancy. The project I'm talking about today follows on from a research project Madeleine and I have run together over the past couple of years. And key outcomes from that project include a large-scale qualitative interview study with Natural Cycles users. We've interviewed over 130 of them individually across 4 different languages. We've also conducted a series of workshops co-designing new interactions for establishing and maintaining trust between the Natural Cycles algorithm and users, both primary and secondary. We've published an article on ambivalencies in digital contraception and how to design for mixed feelings, published at the DIS conference this year. And recently we got accepted an article that presents an analysis of over 3,000 reviews of Natural Cycles published on Google Play up until September 2021. That paper is going to be coming out in the Journal of Medical and Internet Research. For this consolidator project, we are focusing specifically on challenging experiences related to digital contraception. We'll be completing some complementary data collection, interviewing individuals who no longer subscribe to Natural Cycles as a form of contraception. We'll be co-designing user experience mechanisms that respond explicitly to what an intimate digital health technology could do to re-establish trust when it has been challenged or lost. And we'll be completing the analysis of our large-scale qualitative dataset, where we're currently focusing primarily on the layers of trust that are central for digital contraception, as well as interviewees' accounts of the risks and benefits of digital contraception. So to say a little bit more about the large-scale interview study we are now analyzing, we've collected 134 semi-structured individual interviews in 4 different languages, English, Swedish, Spanish, and Finnish. And the interview topics broadly concern issues such as the participants' history with Natural Cycles, their daily routines, changes in bodily awareness, and shared use and shared access related to Natural Cycles. The aims of the complementary data collection then are first and foremost to interview individuals who no longer subscribe to Natural Cycles as a form of contraception. And what we've seen so far already is that scares and concerns come up even for the kinds of participants we've interviewed so far. That is, people who have mostly positive experiences with Natural Cycles and have opted to discuss them with researchers. And for a more nuanced understanding of the potentials and limitations of intimate digital health technology, we need to understand what happens when something goes wrong and how and to what degree user experience mechanisms can help re-establish trust when it has been challenged or lost. So the research focus on this new project is on challenging experiences with Natural Cycles. And our main interest is what happens when something goes wrong with the use of an intimate digital health technology. What can be done to re-establish trust? We've organized the work into 3 work packages. First one focused on the interview study and creating an understanding of when trust gets challenged in use. Second, we'll be working to develop mechanisms for re-establishing trust with the help of co-design workshops. And finally, we have a work package for theoretical development, book preparation, and dissemination. Our layered approach to trust encompasses also psychological, contextual, and interpersonal factors, not just the trust between the user and the technology. And this approach then both questions and enlivens current models of trust in AI and algorithmic systems. For some early insights from the research so far, what we can really see is that there is a layered trust situation happening with natural cycles. First, of course, there are questions of trustworthiness of natural cycles, both as a form of contraception and as a company. Second, what becomes really important here is that trust here is also about the participants' confidence in themselves. So, coming to trust oneself as a user of natural cycles, being accurate and consistent enough to use the system in a way that it can provide reliable predictions is really key in the interview accounts. And secondly, and really interestingly, there's also a lot of talk about how using the app can help one to come to trust one's body more. Third, interpersonal trust, perhaps unsurprisingly, plays a big role here. We're talking about contraception, so issues that have to do with trust between partners and the partner's confidence in natural cycles naturally come up. And finally, worth noting is also that the trust relationships we see developing here are developing despite often discouraging signals that might come from healthcare professionals or family members who are dismissive or questioning of natural cycles. To say a little bit more about the issues having to do with trusting oneself. So really core for the use of natural cycles is coming to trust oneself to be able to use the system accurately and consistently. And what we see in many of our interview accounts is that if participants feel that they have failed to do so, they consider that it is not the app that is to blame for any potential adverse outcomes. And many participants really place responsibility on themselves rather than the system. So some quite strong user responsibilization happening here. And secondly, trusting one's body and its signals is something that comes up quite strongly in the interview data. So having the app confirm what one senses in one's body can really lead to a better understanding of one's body and help taking interpersonal bodily experiences seriously. As for the trust between partners, there are multiple aspects at play here as well. First of all, of course, getting partners to trust natural cycles is often falls on the main user to be the one taking the initiative to start using this system, and hence they are also in a position where they need to inform their partner or partners about what the app is all about. Secondly, some interviewees also talk about the work of getting partners to trust the interviewee's use of natural cycles and their intentions with it, so there can of course also be more strongly interpersonal issues at play when it comes to trust in relation to digital contraception. And sometimes the use of natural cycles, the participants also talk about it leading to increased trust and closeness in relationships. And this tends to be especially when partners do have learned more about the interviewees' bodies and their bodily rhythms, and sometimes just generally about reproductive health, such as when in the month one might get pregnant. As for shared use and access, what we can see in our data set, and this is really where it becomes obvious why having such a big data set of qualitative data that's quite unusual is very helpful, is that we can see really diverse practices and experiences related to the shared use of natural cycles. Some interviewees are very firm about natural cycles use being their personal choice and nobody else's business. They may inform their partners, but they don't feel like this is something that needs to be decided together. For others, natural cycles use is much more collaborative, and there is also sometimes quite active partner involvement in the use itself, such as the partner, for instance, sticking the thermometer into the participant's mouth in the mornings. And some participants really struggle with how they should handle sharing with their partner or partners, as this isn't necessarily something that's quite self-evident. Going forward, we believe taking and managing risk will be a core issue to explore. So risk-taking with natural cycles and complementary forms of contraception is certainly something that comes up in our existing data, and we believe it's going to be even stronger once we start talking with people who may have had more challenging experiences with the system. So we want to understand more systematically what risks do participants perceive and what makes these risks appear worth taking. From the initial data set, we know that there are many participants with quite rough histories with other forms of birth control for whom moving over to natural cycles, even if they were to regard it as an imperfect mode of contraception, might seem desirable just to avoid physical pain. tough symptoms such as depression and so forth. So just knowing that the alternative has not been a fit for them. But what we also see is that issues such as sexual pleasure come into play in people's choices related to contraception and their use of a system like natural cycles. Moreover, relating to risk, we're also really interested in practices that introduce extra caution to the use of digital contraception. We've seen examples of people adding a few days of margin when the prediction is about to turn from green to red, so as be even more conservative in their use of the model than what the app would be dedicating. And also many interviewees talking about starting to rely on natural cycles gradually over an extended period of time, where they might use the app for several months before gradually moving away from using complementary forms of contraception continuously. So, to sum up, this project, Layering Trust in Intimate Digital Health Technologies, Learning from Challenging Experiences, is focused on interviewing prior users of natural cycles to learn about what happens when trust in digital intimate health technologies breaks down. Of course, not all prior users have stopped using the system as a contraceptive out of having had a challenging experience, but we believe this mode of sampling will help us unearth more of those difficult experiences. And in the second phase of the project, we'll co-design user experience mechanisms that respond explicitly to what an intimate digital health technology could do to reestablish trust when it has been challenged or lost. Thank you for listening.